Okay, we are finally live. I just shared the link on the other event page. We had a problem. I don't know if I had too many new plugins I was trying to use or what, but we are now starting this week's What's News in Healthcare Social Media with me, Kathy Brown, Brown Knows Social Media, and my guest today is Mark Ackley. And Mark Ackley is the principal at Healthcare Transitions, and we're going to speed through this because I know a lot of people have missed out earlier, so I don't know if we're going to be able to get our original viewing audience or not, but we're going to dive in. Mark, we were talking about some articles. I don't even have the articles in front of me now because we've been running around with all the technical stuff. The first article we were talking about, you don't happen to have that one still drawn up, do you?
I don't. Sorry. I was planning on you introducing it, but if you can introduce the article.
Okay, let's see if I can pull this up. I just have to get back to my document here on, I've got so many things. We've been racing around. We were talking about the direction that healthcare is going, or the direction of social media in general, and the fact that healthcare seems to be behind the 8 ball in a lot of respects, especially in social media. And I'm going to pull up the article here in just a minute so we can say, but you want to go ahead and talk about what you were talking about off air because it was so good. I don't know how many people heard it or how long they heard it,
Sure.
But why don't you go ahead and pick up from there, and I'm going to try to pull up the articles as we go.
Sure, and let me just do this then. Folks, I guess the salient point here is that in our data-driven experience economy, businesses today can very, very elegantly capture data for all facets of your life. They know where we shop. They know where we play. They know what movies we watch. They even know the venue that we prefer. The article that Kathy posted is an absolute great introduction to the level of sophistication in today's marketing world. It speaks to the management of big data and how it's used. And in the private sector, and the retail sector, and other businesses that have to connect with their customers through sales or whatever means, there are very sophisticated methods to use this data and really kind of get into their market's brain in terms of how do we connect. And I think just to fast forward the conversation, I'll ask, why is it that healthcare, whose principal job, whose principal world is to connect with people to take care of them, why do they still reside in the 18th and 19th century when the techniques and level of sophistication is far, far ahead of anything that healthcare can imagine? And so I'm going to leave that question out there and let it hang and let Kathy go from there.
Thanks, Mark. Well, we've had some discussions about that in the past, about how there's so much data to be found and so much insight that you can have from the audience that you're speaking to. But I think a lot of people think that it's too expensive to get. When we talk about big data in healthcare, most people think about medical records and the really big data that you need large engines to access. And what we're talking about is digital data. The information that you can access even from a website so that you can customize the information that people have, so you can know more about who is visiting your site and if you're getting the right people, and all of the information that we can even buy in small chunks so that we understand who our audience is and what they're interested in. And we don't see a lot of that happening in healthcare for some reason, that they're tapping into that, that ability. I don't know if it's the budget so much as it just seems like it's too big to tackle.
Well, I think we live in a world of where patient information is protected, okay? And let's just leave that out there for a second, okay? However, I do believe that there is a way to continue to contain this protected information, but still use social media and other venues to connect with people, because we're connecting with more than just their disease state or whether or not they visited the doctor. We're connecting with them on a level about their life and about where they live and about why we should be the provider of choice. For everybody in the audience who hasn't met me before, when I met Kathy a while back, a lot of what we discussed was the way that we had developed a social media platform in Pittsburgh, Pennsylvania, and connected with thousands of families through social media. And we were still able to maintain a very sophisticated level of privacy, and yet our communications director, who is an absolute genius named Chad Herman, was able to create a social media platform that really helped us connect with people. It wasn't about the number of likes. It wasn't about the number of retweets. You know what it was about? It was about people who said, hey, here's a doctor's office that wants to connect with me, and I'm going to stay tied into them, and I'm going to check, and I'm going to stay tied into them every single day. It was an amazing thing.
There's a comment that we have here I want to read to you. It's from Janine Bevan. She says, Kathy, it's because this whole move to EHR and HIPAA compliance is for the benefit of payers, not patients. Oh, so they say patients, but we're actually considered consumers. And have you seen where hospitals are buying big data now, meaning the aggregated shopping data, so it can be sold as a commodity, so they can market to us properly? I think that's a really good point, that some healthcare marketers, communicators, still see patients as a market that they have to sell something to, as opposed to communicate and educate and provide a service to. You agree, Mark?
I think it's a good point. I think at the core, though, we are also selling something. You're selling a level of confidence in someone who can take care of you. But I'd like to take it one step further and talk about why the entire healthcare system is so slow to respond. This data has always been available. So fast forward, and you have some forward-thinking CEOs who say, hey, let's start buying this data. Okay, now what? Do you think that the healthcare industry may be just a little too paranoid to start marketing in this respect, because of just traditionally we're a paranoid industry?
You know, that's a great segue, Mark, because our second article that we were going to cover is why CEOs should not be involved in social media, and it was by Explore B&B. And that is the general thought based on this article, but it was interesting, not what the author of the article had to say, but of the commenters that responded to the article, because there are definitely two trains of thought here. The CEOs who think they don't have time for it, it's not important, it doesn't belong in their job description, and then those CEOs who are forward thinkers who say, hey, look at this tool for me to communicate. I know which bucket you fall into, Mark, but would you like to speak to that? Because I really think that's an area where you have excelled.
I think that it is our responsibility in healthcare to use every means possible to connect with the people that we expect to put their lives in our hands. Period. And we can secure their data, we can connect with them on a human level, on a personal level, and manage the relationship outside of the clinical encounter separately.
Mm-hmm. Well, and CEOs have a story to tell. I remember a CEO that my husband worked for, and when that CEO would have the large C-suite meetings and tell a story that explained the vision for the company, he would come home charged, ready to do whatever it took, because he was inspired by leadership. And I think social media is a tool that too many CEOs fail to realize is a tool to inspire, to make change, to move forward, and to do something great, because you've got people on board because of the way you communicate.
Again, I'm going to agree with you, but I'm also going to add that there are many, many things in life that we can use to inspire leadership. And I think that the CEOs who understand that social media is one tool in their, or one weapon in their arsenal that they can use, I think they should get more excited about it, but I really think that their level of understanding and sophistication in terms of the technology and the connectivity, probably maybe it's just not there.
There's an interesting question that I would like to share. This has come up. I'm not going to attempt to say the name, but the question is there the possibility of misuse of this powerful tool? Have you known of any? I'm trying to think of how CEOs would misuse social media in healthcare, and I can't think of any.
Well, if you think about it, and let's go ahead and go down this road a little bit. I think the short answer is yes. It's possible to misuse this tool. I mean, evildoers are going to find a way to do evil with everything. Okay, but if you think about it, if you're using social media in a healthcare organization, there is the possibility of accidentally revealing information. There is the possibility of accidentally revealing private facets about people that you work for or that work for you.
Yeah.
There are certain department strategies that you want to keep under wraps until they're ready for the big reveal. I think there's possible ways, but these are accidental. I think that one thing that we need to do again in healthcare is we have to continue to try to find these little places where we fail or where we can tweak the system to do good, as opposed to staying in that paranoid state where we're afraid.
Well, because we have wasted a lot of time earlier in trying to get this Hangout to work, I'm gonna move on to the next article and talk about transparency. It's an article by, let me see if I can find it here, by NYU ComproBiz, and it's Rethinking Corporate Transparency, Healthcare Companies and Crisis Communication. And it talks about using social media in a transparent way, but is there a point when transparency is no longer a good thing, and are healthcare organizations to be held to the same standard of transparency when it comes to social media? I think it was an interesting point in this article, not only with what is involved with HIPAA, but in general, that healthcare can't be quite as transparent, whether it's in pricing or patient information or anything else. And I'm still deciding how I feel about that. So what are your thoughts on that, Mark?
I think that's probably a great topic for another Google Hangout on another day to talk about transparency. Because there are two camps in the world of transparency, but again, I'm going to fall on the side of more transparency is better. Sunlight it cures everything.
Yeah.
So I'll leave it at that.
Well, I'll tell you one area where I think transparency is beneficial in healthcare is when there is a story that goes, I don't want to say viral because you think of that as being worldwide, but when it goes locally viral, when people know about the story, when they find needles in the dumpster, or they find out a doctor is abusing substance, or whatever that news story is, I think in that case especially, becoming transparent and stepping forward, a leadership specifically, stepping forward in a very social environment and saying, we're going to take ownership of this and we're going to do what it takes to fix it. And as part of that, we're going to open our channels to communicate with anybody who has feedback, suggestions, additional information, and we're going to move forward, and here's how we're going to move forward. I think in that way, being transparent is definitely beneficial as opposed to trying to hope that it just goes away. All right, I'm going to move on. I have another guest with me. I've been sort of hiding him. Every once in a while his face pops up because of the way I didn't have the screens locked and noises. So I'm going to introduce right now Alden Autangan. Did I say that right?
Yes, you did.
He is co-founder of Simpler. And Simpler, for those of you who have been living in the dark, because I talk about Simpler all the time, Simpler is a wonderful website, and on that website is the Healthcare Hashtag Project that indexes like the Wikipedia of healthcare hashtags, so that you can go in and either find a hashtag that already exists and learn what it's all about and who participates in it, or establish your own healthcare hashtag and have it added to the library. And there's so much information to be gained But even more recently, there is additional information to be gained called simpler signals. And it was announced at Doctors 2.0, and I'm going to let Alden take it away and tell us what, first tell us a little bit about you, about Simpler, why it was formed, and what Simpler Signals is all about.
Sure. Yeah, so a little bit of history about us. We, we started the Hellkoschka Project, I think, almost 4 years ago now. And it started out just as a small list of healthcare hashtags that we knew about. And the reason why we created a list like that is because we wanted healthcare providers in the US, which was primarily our clients, we wanted them to adopt Twitter and Facebook. But it was hard for us to get them to adopt it because they looked at Twitter, and back in that time, if you remember, Twitter was looked a little bit down upon as the place for tweeting your latest meal or something like that. It was not taken seriously. So we needed to show that yes, there are some serious conversations taking place here. So we created a list of hashtags where these conversations are, were around. So there were hashtags for orthopedists, dentists, and so forth. And then we shortly thereafter we open it up so that other people can submit their hashtags to the list. And so in one word, we made the project itself social, and that just exploded. People added so many more than we did not know about, and they started creating new ones. There's always need to create a new community. So that just took on its own life, and I think about now we have well beyond 4,000 hashtags, all healthcare related. And throughout that time, we started showing a little bit of stats or analytics. Okay, for each hashtag, who are the main participants in the discussion in this community? So we made a list of that. And what are the main topics being discussed, though, and the trending of each hashtag. So very very basic analytics, but it's good enough so that people who wanted to see what value healthcare social media or Twitter had for them within healthcare, they can go to this place, look at the specific hashtag for their own medical specialty or their own disease area, their own condition. And they say, wow, there are some interesting conversations taking place here, and here are a list of people that I should follow within my condition. So we've seen just wonderful things come out of it, and most of the features we added from since then, has just been us trying to respond to the community. People coming to us, wouldn't it be nice if we can have this feature? And we said, sure, yes, we'll do our best. And then this has just grown like it is today. And now, last month at Doctors 2.0, which is a conference in Paris, a wonderful conference, we announced this new tool that we have, a new service called Simpler Signals, which is something that we've been worked on for a very long time. Since the start of the Hellkoschka Project, certain people and organizations have come to us and asked, you guys have all this data. Can we do something together to do some research? And for the most part, it's been academics and medical specialty organizations, associations, and we've done a lot of projects with them. And so behind the scenes almost, or internal for us in our company, we have developed tools to do some more deep diving into this data. By the way, now I think we were about 500 million tweets, healthcare-related tweets in the database. So it's a big milestone we just crossed this summer.
Wow.
And so we built internal tools to do some more deep diving in the data. Those tools we now sort of try to polish up, and we made it into a product that third parties can use, so not just us. So in other words, we would want more people to access this data to do their research and to gain their insight. And so we handing the tools over to third parties that fit the bill. And so we're trying to make this data more available to democratize a little bit the insights that can be gained from it, because we know that there are so many stories to be told from it, from the data. There's so many insights that we should have, but we don't have because we at Simpler have very limited time and perhaps not enough ability or creativity to think of all the various research that can be done. So we're very excited about this and hope to see what will come out of it.
Well, Alden, can you tell me, how can we access this tool? Is this something that you have to subscribe to, or it's automatically there? How do you get to that information?
So this is a very high-end tool, a research tool. So it's a subscription-only based for now, and we're taking it very easy because it's a really large load on our servers. So we need to be careful and not overloading it. So we're starting very slowly, and we'll see what we can do in the future to roll out it to more people. But yeah, this is not open and freely available, just like the Hellkoschka project. This is it's a subscription-only tool.
So can you give us an idea of where this would be most useful? Can you give an imaginary situation where someone might take advantage of the information, and what that information would be and what it might reveal?
Yes. Well, just like you talked about transparency and the need for people to read the data. You know, every organization today in healthcare too, they collect an awful lot of data, and I think we're just about trying to understand what we can do with it. We've done the same thing, collected an awful lot of data, but now we're trying to provide ways they can immediately take advantage of it. So this is for larger organizations, whether they're research or otherwise, public health, government, that they can understand what's being done, what's taking place within the healthcare social media space. And I think it's important for them to understand what are the providers saying, what are the physicians saying, what are their concerns, what are their sentiment towards these things. What articles are being shared by the providers versus the patients. I think there needs to be insight and knowledge about this so that they can make their decisions wherever they are.
That's very interesting. I want the viewers to know that I have published the link to this Hangout inside the event page. So if you go to the event page, you'll be able to click that link and join the live discussion. So we'll see if anybody joins us today. I know sometimes people are working while they're listening, and we did have a delay, so we might not have anybody jump in. But if you do want to jump in, get in now, so I know that you want to be in this discussion. Can you tell me, Alden, is there any one specific example of an aha moment that you have gotten from the simpler signals that have been processed and evaluated? And I'm not asking for the secrets that you charge for, but just to give us an example of the value of the signals, something that you can give us a tangible example of what that evolves into.
Sure. Well, we've been using this for a very long time, so there's a lot of insights we have gained from this. But I think one of the surprising ones, which is a few years back actually, was that we initially, like I said, we thought, okay, this is Twitter is a virtual water cooler where professionals are having their discussions online. You know, doctors talking to each other and so on. But then we saw the explosion of patients adopting Twitter and other social media networks, and we were actually really surprised by that. And we saw that from the data, that wherever there used to be mostly professionals, whether providers or consultants or third parties, the patients joined in discussions. And then we have done research on specific communities, disease communities where there's a focus on one illness, chronic illnesses, And there we see many wonderful examples of a community that are very dynamic, where boundaries are truly broken down, traditional hierarchies within our healthcare system, where patients and providers talk to each other basically on an equal footing. Very, very flattening of the whole healthcare system. So we see that, and yes, it takes a special kind of patient to be involved, and it takes a special kind of provider, a physician, to wanted to do that. And but you can see the fruits from that. Those communities are tremendous. They're the most successful stories. Mm-hmm. And so with Simpler Signals, we're able to basically visualize what's taking place. Those who are active in these communities, they know what's going on. But for us who are not daily active in these communities, it's nice to be able to visualize, take a look at the data, and then visualize it to see who's talking to whom, and who are making up this community. What are they talking about? And what sort of issues are the most concerning to them? So yeah, we've used signals for questions like that. We're able to basically visualize.
We have one viewer joining us. So Scott Scowcroft just jumped in. So Scott, would you like to say hello? I can't hear you right now, so maybe you can turn on your microphone.
Sorry, just kind of getting organized. This is a fascinating conversation. Please continue it. Don't let me interrupt.
Well, actually, I'd like to know, do you have any questions? Because we've just finished talking about Simpler Signals and the fact that patients have gotten into the whole conversation of healthcare, especially on Twitter. And it's interesting that Alden has brought this up because tomorrow's guest is Casey Quinlan, who is well known in the e-patient world, and she's going to be talking about how patients are using technology like Twitter to empower themselves and to get more knowledge and to share knowledge. And this is where Simpler is able to send people in the right direction to participate in those conversations and to provide more insight through Simpler Signals. Do you have any questions or comments?
Sure, I do. I was motivated to come on into the film strip to talk because after a couple of years hiatus, there's a community, Google group community that I have called ePatient Crowdsourcing Resources Directory, and I've kind of let it go fallow for a while, and a couple of us are thinking of trying to reinstitute it and start moderating it. So the discussion is ground zero for that, in terms of the power of e-patients and their families and caregivers, finding out what it is that is important to them to know, and then to collaborate with other stakeholders and professionals to come up with new solutions. I'm wondering if your guest might have some examples that he's witnessed of something like that happening.
Alden, do you have any examples of people that are doing that? Or Mark, do you know of any? We have silence here. Can you elaborate a little more, Scott? I'm not sure that we understand the question exactly. Are you?
Well, sure. Well, it's just that it seems as if there's a revolution going on, that e-patients and their families and caregivers will research a great deal about whatever chronic malady or illness that they have, as an example, especially if it's something that's rare. And at the end of the day, they help each other ferret out some of those areas that a number of medical professionals might not have had the time to figure out. It's so granular that it's very important to them, but it's just one of a sea of details that professionals would have to learn. So the collaboration between professional e-patients, I suppose is what you could call it, and the rest of the community just populates the, I'm using too many words here, but populates the knowledge base, and then all of a sudden someone who just hasn't been able to figure out what's wrong with me or what the best solution should be, here's the answer because someone's already walked around down that path, and they're willing and happy to share it. So I was wondering if there are examples of that very phenomena that have surfaced as a result of the project that you're talking about today.
About simpler signals?
Yeah, simplicity.
Yeah, so we can share a little bit about that. Because you specifically mentioned chronic illnesses or rare diseases, and that's an excellent example of where that is actually taking place. And if you go to the Hellkoschka Project, we about a year ago or so, probably more now, we did launch a section specifically listing rare diseases hashtags on Twitter. And that is something that we observed growing immensely, just because of the same factors you mentioned. People have these conditions over a very long time. They gather up a lot of knowledge about their own disease, more than many physicians would know. And of course, so you get to the point where you would love to get the pleasure of sharing the knowledge with other patients like yourself. And that's the wonderful thing about the rare disease communities, because they are truly cross boundaries. There's no geographical borders hindering them. They're communicating across the globe constantly. So for us, it's been just wonderful to see that taking place. And yeah.
Yeah, that's terrific. Just wonderful what you're doing.
Well, and Scott, you may want to save that question for tomorrow's hangout with Casey Quinlan too, because I'm sure that she'll have some directions to give you as examples as well, because I know she's out there in the e-patient space quite a bit, and she might have some examples that she knows of that maybe even the healthcare community isn't aware of. We have another viewer joining us, Sheila Strover. You want to say hello, Sheila?
Yeah, hi.
Did you have a question or a comment?
Beg your pardon?
Did you have a question or a comment?
I just find it fascinating when I'm at the other end of the spectrum, where my bulletin board is just patients talking to patients all the time, to see experts sort of working on the extractable data. It's two extremes of a continuum, but we need to bring those two ends together, really.
Yeah, and I know that with what you do, you are on the other end where you see the information that you want physicians to talk about, and you try to bring that to light. Are you using any hashtags or anything so that people can find your data trackably?
We never did, and that's something that I'm beginning to see as a shortfall. Within the stuff I do on Google+, I hashtag everything, but in my very old bulletin board, which has been running for over a decade, I don't think hashtags existed when we started it off, and we've just never added them. So I'm going to speak to the programmer and see. We can't do anything retrospectively, but we can do it prospectively, because it's clearly important.
You haven't had any tweet chats or anything on the topics?
No, I tend to. The main focus of my bulletin board is the website-based bulletin board. It's not. It's a social space, but it's not what's known as social media. It's not Twitter. It's not Google+. But I need to just gain more knowledge and see how I can integrate that very huge body of knee data or knee talk, knee speak into the more mainstream social media now. And obviously hashtags is a very easy way to do it. So I must look at that and understand it better.
Alden, does Simpler look beyond Twitter for the data? Can you speak to that? Are you limiting your hashtag search to Twitter or to the entire internet?
No, we started out with Twitter, and we did add some other data sources later on. We did track, for example, Instagram actually, because they are also totally open and have a prolific use of hashtags. And there were some healthcare organizations wanting to track that, so we did that. And there's actually quite a bit of healthcare usage of Instagram. I was a little bit surprised at that myself. We do take a little bit of data from Google+, Facebook, LinkedIn, Pinterest, but it's very limited. And it's also one of the reasons why we do like Twitter. Is a couple of reasons why it's totally open. And just to talk to Sheila there, Strover, The reason why some patients go to Twitter or one of these other open social networks is just because it's open, so that the information they share can get the widest possible reach. And I think that's what's attracted some patients to Twitter, because there are cases, strong cases for having closed patient forums on secure websites where they can talk with full privacy. But if you want to change healthcare, if you want to change the way your disease is being treated in the healthcare system, or if you just want to spread information, then you need to be in a fully public open forum, and Twitter is a great example of that, where information spreads really widely, and so I think that's what attracted especially the e-patients to Twitter. Yeah.
So what about YouTube? Because I know YouTube is an open platform, and when we do these Hangouts, they're aired on YouTube. So, and I do use hashtags on YouTube. So am I getting the benefit of that hashtag on YouTube through Simpler or not?
We don't track YouTube, but I do believe that they also have an API. It's been a long time since I looked at what exactly the API gives us. So yes, it's a good question.
Well, if you're taking requests, that's one.
Yeah. Okay. Thank you very much.
Do we have any more comments, questions?
Kathy, I think there's an interesting correlation here between this world of information and this world of healthcare and clinical informatics and wellness. And if you look at the natural progression of our healthcare system that has moved from episodic care to standards of care to chronic care models, and now we have these initiatives like patient-centered medical home that are designed to create more efficiencies in the treatment of chronic and rare diseases. I guess the question that comes to mind for me now is, if you have a medical home that takes care of your health, as a healthcare consumer, where is your digital home? Because there is the place where information is warehoused for you, where you can gather it and educate yourself and collaborate with other people outside of the clinical experience. It'd be interesting to see a blend of both the medical home and a patient's digital home.
Interesting. Well, I think you should write a paper on that, Mark.
Boy, opening up a discussion that could go on for another half hour. I think I'll reserve some comments simply for that. But Kathy, I think you have subjects for new, if not for new episodes, for a new series.
Yeah, definitely. Well, we are at the end of our What's News in Healthcare social media hangout. I'm just so glad that we finally got this working after some of the issues we had. I'll have to track down what it was that made everything crash, but I appreciate all of you sticking with it and joining me, and we are going to have to wrap up this week's edition. So this is the wrap-up for this week's edition of What's News in Healthcare social media. I'm Kathy Brown with Brown News Social Media, and my guest Mark Ackley, and my guest Alden Utangen. I think I said it right. I'm trying to say it a little more like he did.
Yeah, you did a great job.
There are a couple articles we did not get to cover that I listed on the original event page. One is about smartphone users and their desire to communicate with doctors. We'll have to save that conversation for another time. But do take a look also at this example I give of the falcon that a hospital covers. We didn't get to talk about that, but it's an excellent story. And I wouldn't want you to pass that up, because I think it's a nice human interest story that just gives a human face to the people who are inside the walls of hospitals. So have a great rest of the week, everyone, and I will see you next week. Next week's guest, by the way, is Lee Acey of Mayo Clinic. So we ought to have an interesting discussion there, too. So goodbye, y'all.
Thank you. Bye-bye.